So the second part of the activity has to do with marketing material. The pharmaceutical industry spends a lot of money on marketing and advertising. Of course, you see all uh, the TV ads for drugs. Of course, in not only medical journals but also lay press magazines, there's pharmaceutical ads. And then one of the things that pharmaceutical reps will use in the office to communicate their messages is similar material known as detail aids. And what I've done is created a fake detail aid to demonstrate techniques that have actually been used in various products. So what you do with the activities, you hand out this fake detail aid, you let the students know that it's clearly fake, and give them a few minutes to evaluate it. And you're going to ask them two questions. Question number one is there anything in the information that can be misleading, that might overstate the positive effects of the product or understate some of the safety concerns? And then you could also ask the second question, if this were a real product, would you use it? Why or why not? So what you can do, give the handout out to the students, let them evaluate. If you want to break them up into small groups, that's totally fine. You can do it that way. Hand them out and then see what they come up with. And there are several errors, if you will, or several techniques that have been used in this detail aid that I want to highlight. And so I'm going to go through those in detail with you. Again, let the students come up with this, but make sure that you don't, that as you go through that they don't miss it. Okay. So this is the detail aid. There's a front which shows a graph, and it's designed to look like something a pharmaceutical rep might hand out or something you might see in a medical journal, with some claims, which tells what the product does, as well as some graphical information. Back also has some advertising. It has also graphical information. It has some of the safety information and some references in the very small print at the bottom. So again, you're going to give this out to the students and ask them to review it. You can do it individually. You can have them go in pairs or in groups, and to see if there's anything that might be misleading about this advertisement, or overstate positive things, understate negative things. In addition, if this were a real product, ask them whether they would use it or not. So there's a lot of things in this article that the students, or this advertisement that the students might find, but I'm going to point out some of the key specific ones that hopefully they'll come up with on their own, but if not, it's important for you to come up with. So the first one has to do with absolute risk versus relative risk. This is probably the most common thing. So if I have a pill that reduces heart attacks from 50% to 25%, the relative risk reduction is a 55% risk reduction, but the absolute risk is only 25%. And so in this case, you can see that halitosin reduced bacterial growth by 40%, but that 40% is only the relative risk. The absolute risk is 50%, versus the placebo did at 30%. So the absolute risk is only 20%. So the use of relative risk overstates positive claims. The other thing that sometimes they'll do is manipulate graphs. So if you look at the bottom of the y-axis, or the bottom of the graph, it's 20%. So most graphs should start at 0%. So if you can imagine this graph starting at 0%, the difference between these two bars would actually be a little bit less, at least visually. The other thing we need to know about is, where did the data come from? So at the back of the page, the second page, at the very bottom, you see the references, and some of this is direct from the FDA. But when a drug gets approved, it doesn't have to have that published data. And so often what they'll do is use something called data on file. And again, it doesn't mean that it's necessarily bad data, but you should be a little bit more skeptical if the references or FDA announcements and data on file and not publications in major journals. The other thing has to do with significance. So this is again the graph on the back of the page, and it shows that halitosin significantly increased social confidence index scores by 55%. Well, the first thing is that statistically significant or not? We don't know. We don't have the data. It would be nice to have that. You'd want to see a p-value to see whether it was statistically significant or not. But even if it was statistically significant, is that clinically significant? What is a social confidence index? What does that mean? If we bump it from if there's a 2-point difference in social confidence index, does that mean anything clinically? In fact, is the social confidence index a real score or a validated tool? These are some of the questions that you have to ask. The other thing that we want to talk to the students about is outcome data. So, for example, if you have a cholesterol medicine, what you want to do, the outcome you're looking for is like heart attacks and strokes. The LDL reduction or cholesterol lowering is actually a surrogate outcome. And so even though we have to use surrogates sometimes, we really want the hard endpoints. In the case of halitosis, bacterial growth is actually a surrogate marker. What we're really concerned about is reducing bad breath. And does we know bacterial growth has something to do with bad breath, but does reduction in bacterial growth really do anything? Is that a good measure or not for bad breath? That's the outcome we seek. The other thing is you can see that it's comparable to placebo. So we know it's better than placebo in bacterial growth, but does that mean anything? What if it was comparable to mouthwash, which is, I guess, the gold standard? Does this make any difference? It's possible that mouthwash might even do better. Again, the drug companies, in order to get a drug approved, only need to show that the product is better than placebo. It doesn't have to show that it's a standard of care. And then finally, another important thing I want to make sure we point out is this concept of medicalization of normal life ailments. So halitosis is something that some people deal with, but is that something that we need an expensive pill for? There's many examples currently. Low T is something that I'm sure you'll see advertised during the Super Bowl for products related to that. Is that something that is a real disease, or is it part of aging? And then finally, appeal to celebrity. If you don't recognize Britney Spears as the actress in this particular ad. So that is our fake pharmaceutical detail aid, and hopefully this video has been helpful, giving you the information that you need to run the session.